More than 2,000 people have died in Arizona since the start of the coronavirus pandemic. The state's hospitals and testing sites stretched to the limit, trying to handle the surge in cases that they're seeing there right now. NBC News reporter Vaughn Hillyard joins me now from Phoenix. It is wonderful to see you, Vaughn. Maricopa County has seen more than 73,000 positive cases. What is the demand for testing like there right now?
The demand is exceeding the capacity here for testing in the state. Quite frankly, the state is processing daily reports of about 12,000 tests, but that doesn't even begin to match the extent to which testing needs and is necessary here across the state. To give you an idea, the big number out of today from the Arizona Department of Health Services is 34%. That is a 34% positive test rate. That means that out of all the tests that are taken today, or taken over the last 24 hours, 34% of them came back as positive. That's nearly double to compare what Florida is at. That is an exceedingly high rate, which means that the spread of COVID across the state is essentially out of control. You know, it was Maricopa County Public Health Director yesterday that said contact tracing right now only gets you so far, because just yesterday, another 4,000 new cases. Trying to keep up with the spread is very, very difficult for these counties. And when you're talking about testing, you know, most folks aren't getting results back for more than a week here in the state because of that demand and because of that pressure on these labs. They do not have the resources necessary to process these tests fast enough. And so folks are going around, in a lot of cases, maybe asymptomatic, but positive COVID. This is a very tough time in the state with no indication that these numbers are going to be changing.
Vaughn, let's talk about the hospitals. How are they handling the surge in patients?
They need staff. Federal healthcare workers have been brought in to assist. There's about 100 that have come into the state over the course of the last week. And I should note that the state has put out contracts for traveling healthcare professionals, including nurses. There's at least 2 different companies that I'm aware of that are seeking folks that work out of state to travel here to Arizona. They're looking to staff about 500 healthcare professionals, the state says, to come in for at least an 8-week period. Because when we're talking about capacity issues at these hospitals, it's not just beds. We're also talking about a lack of manpower that, you know, for now a couple months, these nurses, these surgeons, these others, medical assistants that work in these facilities are working long hours and they're strapped. And right now you are seeing record number of hospitalizations, record number of ICU beds in use, record number of ventilators, that the staffing shortage is really put a crunch on this hospital network system.
Well, I know you've been speaking with a family who lost a loved one to the coronavirus today. What have they been telling you? I can only imagine.
This is tough because I think I know we're at that point here in Arizona, Allison, where most everybody either knows somebody who's been sick or has passed away from COVID. Yeah. Just so far this month, there's been more than 400 deaths that have been reported. In just this first week, more than 400 deaths here in Arizona. And what is scary is the fact that those hospitalizations continue to increase. I want to introduce, if I could, one individual who laid her father to rest. Mark Urquiza was laid to rest just yesterday, a 65-year-old native of Tolleson. Kristen, you now live in California, you were telling me, and you were driving here 1 week ago into the state when you got the call that your father passed away. Will you tell me a little bit about your father and what got us here to this point to you and I meeting?
Sure. I mean, my dad was a wonderful person who was so loved by his greater community. Huge sports fan here. And he was following the lead of the Ducey administration, who downplayed the virus in early June and encouraged people to go out, go shopping, go to restaurants, be out in public. And my dad contracted the virus at some point during that. He became ill and passed away. A month ago, he was completely healthy, and yesterday I laid him to rest. This should not have happened to my father. He should not have died alone in a hospital with a nurse holding his hand.
The building behind us here, Governor Ducey, in about 20 minutes is going to be holding a press conference. What would be your message to him right now here?
Arizona is in a crisis. Governor Ducey needs to do his job and prioritize people's lives, shut down businesses, require mask wearing, and do more to protect people who are on the front lines of this. In particular, Indigenous, Black, Latinx, and people of color communities that are on the front lines holding our economy together and can't work have to go out and work half of the time. So I want to know, what is Ducey doing to stop the spread and to help those communities most impacted like mine?
What about to your own community, to Tolleson, to folks in other parts of the state? What would be your message to them?
Keep fighting. Come out, share your stories, be on the front lines, and send your message to the governor's office, because I believe together we can make a difference when our leaders fail us.
Kristen, our heart is with you. Allison, just one family here impacted, and I know Kristen's mother also has tested positive for COVID. This is a real thing that is continuing every single day here. There's big question marks as to what additional steps, if any, the governor here of Arizona will take here this afternoon. Allison?
Yeah, it's a real thing, Vaughn. It's impacting real people. It's hurting real families. Thank you so much for your reporting. And please thank Kristen from us for being so brave and for sharing her story and for asking the tough questions, too, today, along there with you. Thank you.
We will. Thanks, Allison.
Public schools in Florida trying to figure out how to safely reopen. The state's education commissioner issuing an emergency order mandating that schools reopen campuses this fall. NBC News Now correspondent Dasha Barnes spoke with teachers and parents about the decision.
We have seen a lot of emotional and mental instability in our children over the last 3 months, especially because of the quarantine. They miss their friends a lot, and it's caused depression, anxiety in the house. So they need that socialization that's in school, and they need that the role models of their teachers to help guide them through, through their schoolwork and also through life type situation.
Parents want their kids in the brick and mortar setting. They want us to be face to face with their kids because they love us, they trust us, they have faith in the public school system. We just want to get to that piece of, is it truly safe?
You're envisioning right now all three of your children behind a desk in a classroom come August. What do you envision when you think about that? What are the safety protocols? What are the tools you want in place?
My vision would be pretty simple. When they're moving around the building, whether it be entering the school or if they have to go someplace to eat lunch or if they have to go to the bathroom, they should be wearing a mask. And they should be doing their best to socially distance, or not socially distance, physical distance from other students or other adults.
It's not just the basic cleaning that our custodials do of mopping the floor, sweeping the floor, dumping a garbage can, wiping down a board, straightening up desks. There's going to be a lot more detail, making sure door handles are taken care of, light switches, things that are touched throughout. That sanitizing piece has to be put in place.
In my mind, I'm not thinking of any circumstances that I wouldn't send them to school in fall. Okay, if the option is there for them to go 5 days a week face to face, I'm going to do that. I want my children there. I think that's the best place for them. There should be a trained educator that's guiding them through their education.
The president actually threatened to withhold funding from schools that didn't reopen quickly enough. What was your take on that?
Well, my take is that I get his understanding of get it open, but using those type of threats on the very people that are his constituents, that our country is a sore core of public education, and people wanting to get back in and needing to get back in, and even those people still want to make sure that they're taking care of health, with their health looking as the number one priority. And it's either you do it or I take funding away. That doesn't help us to get moving forward in the plan of opening the schools. No district, no superintendent doesn't want to open the schools. We want to open our schools.
Dasha joins us now from Davie, Florida. Dasha, let's talk about that emergency order. What are the details here? Is it statewide, and what power do individual districts have here?
Hey, Allison, it is a statewide order. The education commissioner issued on Monday saying all schools must reopen next month. Now, it's still new, and school districts are trying to figure out what it means for them, how they find a way forward. Many are saying that they will make the best decisions for their own district. At the same time, it does put a lot of pressure on, and the education officials I've been talking to have been scrambling to figure out a lot of unanswered questions, because that's the problem, Allison. There's not yet a concrete, agreed upon plan, and so everyone's left to their own devices to figure it out. And it's everything from sanitation to how on earth do you make cafeterias safe during COVID? How do you work with school buses? How do you keep kids from crowding in doorways? There are just so many details, and that's what folks are telling me. They're saying the devil is in the details, and they just don't have those figured out yet. At the same time, you heard there in that sound from those parents, that was Adam and Jennifer, and they are very eager to get their daughters back into the classroom. They've seen them struggling, and they told me that for them, they are aware of the risk of COVID, but at the same time, they are more concerned about the risk to their children's emotional, intellectual, and mental health if they stay home. So it's this push and pull. At the end of the day, everyone does want kids back in classrooms. No one's arguing that that they don't want that. The question is, what's the plan to getting there? And importantly, what is the funding to get there? That's a big part of the puzzle as well.
Yeah, I mean, Dasha, every educator, parent, teacher you speak with, I mean, they have a long list of concerns, a lot of details, as you said, to try to work out to get kids safely back to school. You mentioned it in your piece, the president threatening to cut funding from schools that don't reopen. How are school administrators reacting to that?
Well, Allison, funding was a concern even before the president made that statement. That's something that all of the teachers and administrators I've been talking to, they've been skeptical that they will get enough of the money and the resources that they need to actually execute some of the plans they're trying to come up with right now. At this school I'm at, this is a Flamingo Elementary School in Broward County, which, by the way, this is the 6th largest district in the country, 241 schools that will all have to make significant changes. Just this school in particular, the principal here, Principal Bullock, he told me that right now he's making decisions about hiring more custodial staff, about how to get resources and equipment and masks and sanitizers and all of that into his classrooms. He's making all those choices, and he has not yet received any additional funding. And he doesn't know how much he's going to get. He doesn't know if he's going to get any. So right now he's making these plans in the dark, and that is just the situation of so many teachers, principals, school districts right now trying to figure out what that looks like and if they're actually going to have the resources to put a plan in place once they have one, Allison.
So many difficult decisions there in Florida and in districts across the country. Dasha, thanks so much. It's really good to see you.
Thanks, Allison.
There are a lot of health questions about reopening our nation's schools. Internal medicine physician and NBC News medical contributor Dr. Lippy Roy joins me now. Dr. Roy, it's great to see you. CDC Director Robert Redfield was on Good Morning America today. He said the public health of students is best served by opening schools. Here's what he said.
We're committed to reopening these schools safely. Probably one of the most important issues we have to pay attention to is to make sure in the process we're protecting the vulnerable, whether they're vulnerable students with chronic medical conditions, whether they're vulnerable teachers. But the truth is, at this point, it's a critical public health initiative right now to get these schools reopened.
Which of these guidelines?
And to do it safely.
Dr. Roy, what are the best ways to do what Dr. Redfield said, protecting vulnerable students and teachers?
Good to see you, Allison. And by the way, I had to check a calendar because I didn't see Thursday on your shirt. So
I took a quick break today.
All good, all good. So look, I agree with Dr. Redfield and many other experts who believe that schools do need to reopen. I mean, children, as you know, Allison, they need not only in-class instruction, but schools provided meals. 20 million children in the United States relied on schools for breakfast and lunch, and they rely on schools for health services. But here's the key, and your previous reporter said really that the devil is in the details. There are certain parts of the country where, in fact, it is safer to reopen. In states that have done a really good job in driving down the community spread, it's more effective. They can safely reopen. But as you know, Allison, other states such as Arizona, Texas, Florida, it's where there's still a high level of community spread and the virus is rampaging through, I just don't think it's safe for those areas to reopen their schools. Not yet.
If schools do reopen, what kind of testing protocol would you like to see for children, teachers, staff? How should school districts be thinking about that?
Yeah, so now that said, so there are areas where schools can reopen safely, and I would recommend people really look at the CDC guidelines. Some of these guidelines include, keeping that safe distance of 6 feet between desks, making sure the students and the adults, the teachers and caretakers and janitors and healthcare staff at the schools, they all wear cloth face coverings, staggering pickup and drop off, hand sanitizing, teaching kids to wash their hands for 20 seconds, and making sure that they use a tissue when they sneeze or cough. I mean, there's a lot of guidelines, and then it also has to be tailored to that individual school, that community, and then work from there. But the local communities and school districts have to work very closely with the local public health departments, Allison.
Dr. Roy, the CDC says one of the main reasons schools should consider reopening is that children are less likely to be infected than adults. Do we have enough data to support that?
So the short answer to that question, Allison, is we don't know. We don't have enough information. So remember back early in the pandemic, we did most of our testing on people who are symptomatic and who are older and with chronic conditions. And the main reason for that is because testing kits are so limited. Now, far more kits are more people. But even then, we're not really widely testing children as much as we are adults. That, and in addition, we simply don't have the data to show what the transmissibility of the virus is amongst children. And I hate to use kids now as an experiment to put them into schools where they could potentially get infected and infect the adult teachers and staff, and then go home and infect other vulnerable adults and other immunocompromised people.
Yeah, it's definitely a big concern. Dr. Roy, I feel like we've learned so much about this virus, but there are still so many questions. Thanks so much for coming on with us and helping us to answer some of them.
Anytime.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.